Welcome everyone on the third month's progress report. My name is Martyin and I would like to present you my 3 months work. My PhD thesis title is New Insights into the Application of Teledermatology. I am a medical doctor and a full-time PhD student at the Department of Dermatology, Venerology and Dermato-Oncology at Semmelweis University. My vision is that the latest technological improvements should be implemented in patient care as soon as possible. Therefore, we are working on providing reliable data to facilitate the widespread use of teledermatology. I currently have 2 ongoing projects, one regarding the use of teledermatology and one regarding the use of artificial intelligence in the field of dermatology. So my first project is comparing the diagnostic accuracy of teledermatology systems to face-to-face examination in the diagnosis of skin diseases through a systematic review and meta-analysis. As you may know, skin diseases affect a significant portion of the global population, with a shocking 3 billion people in the world lacking adequate care for skin diseases worldwide. The number of dermatologists per 100,000 people show us that there is the access to dermatological care varies widely across regions. This number is 7 in Germany, 3.4 in the USA, and a mere 0.7 in Indonesia. The cost of a conventional in-person dermatology visit is more than $300, while the cost of a teledermatology visit is approximately $40. These factors highlight the importance of teledermatology as a tool to facilitate the access to dermatology services worldwide. The most popular method of teledermatology is the direct store and forward method, which means that the patient directly contacts the dermatologist, and this connection is separated by time and space. Our clinical question is whether teledermatology systems are as reliable as face-to-face examinations in the diagnosis of skin diseases. We use the PICO framework. Our population is patients with any kind of skin disorders. The intervention is diagnosis made by teledermatology systems, and we are comparing this to diagnosis made during face-to-face examination. The outcome is diagnostic accuracy. Our hypothesis is that teledermatology systems have non-inferior diagnostic accuracy to face-to-face examinations. The clinical implication would be that the implementation of teledermatological systems to patient care would increase accessibility to dermatological services. We conducted a systematic search through the 3 main databases. Here you can see our finalized search key, which consists of 2 domains. The first domain focuses on the most commonly used term, which is teledermatology, and the second domain is all the synonyms of telemedicine with a dermatology-related subdomain. Here you can see a summary of my key articles. As you can see, all of these articles operated with the same PICO. Population is patients with skin diseases. Store and forward teledermatology is compared to face-to-face examinations. And the outcome they were interested in was diagnostic concordance. All these key articles had similar results. The diagnostic agreement ranged between 70% to 90%. Here you can see the flowchart of the selection. We have 22,000 records after the duplicate removal, and we are currently working on the title abstract selections with my co-investigators. So my second project is staying in the field of medical technological advancements in medicine, is investigating the diagnostic accuracy of artificial intelligence systems in the diagnosis of skin diseases through a systematic review and meta-analysis. As you can surely experience, most aspects of our life, even our professional lives, are affected by technology. And one of the most discussed advancements of technology nowadays is artificial intelligence. So one of the important aspects of AI-assisted decision-making is the use of these AI systems in primary care, because 65% of all patients with dermatological problems only consult their general practitioner. So there is a real need for real-time diagnostic support by AI for the GPs to be able to triage these patients. Also, AI may also be important for specialists because it may augment their capabilities, reduce waiting times, and enhance the diagnostic efficiency, which is very important due to the shortage of dermatologists in the world. So our clinical question is whether artificial intelligence systems are suitable for making a diagnosis. We use the PICO framework. The population is patients with dermatological diseases. Intervention is diagnosis made by AI systems, and it is compared to diagnosis made solely by humans. The outcome is diagnostic accuracy. Our hypothesis is that artificial intelligence systems have non-inferior diagnostic accuracy to dermatologists. The clinical implication would be the implementation of artificial intelligence-assisted systems to improve patient care. We are currently at the feasibility check stage of this project, and we are working on designing the appropriate search key. So in summary, I have two projects. The first one is regarding the use of teledermatology, and the second one regarding the use of artificial intelligence in the field of dermatology. Thank you for your kind attention, and I would like to finish my presentation with, I think, the fitting words of Marie Curie: "Nothing in life is to be feared, it is only to be understood." Thank you. Oh, sorry.
Congrats. Are you planning? Hi.
Sorry.
Are you planning to limit or do some subgroup analysis in both projects to certain specific skin diseases? I would assume that maybe AI would perform differently for tumor diagnosis, whereas for dermatitis it may be different.
Yeah, that's right. We are not planning to exclude any skin disorders, but we are planning to do some subgroup analysis based on the different disease categories.
First of all, thank you for your wonderful presentation. And I have actually a similar question regarding your first project, that your patient population, your PICOs included key articles were patients with skin diseases. But how similar are these articles regarding these skin diseases? Because I believe there's a difference in diagnostic efficacy of teledermatology regarding different skin diseases, and I wonder how comparable these articles are.
Well, there are a lot of articles which only focus on predefined set of diseases, so for example skin cancer, but there are also some articles in which they use teledermatology as a tool for diagnosing any kind of skin disease. So there is data available for both cases.
Thank you.
Thank you.
Hi, here. I love your topic very much. I would like to ask about the first one. So you will basically comparing the telemedicine versus in-person checkup. My question would be how you would distinguish the effect of telemedicine in comparison to effect of different observer. You know, like even two dermatologists can disagree on diagnosis. So how would you know that it was an inter-observer disagreement or it was effect of telemedicine?
Well, in several articles, they report if there was any inter-observer disagreement. And I think that it's a strength of my key articles that there were several dermatologists who did the face-to-face examinations, and also there were several teledermatologists. So the gold standard was the face-to-face examination in every case, because in these cases there were no intra-observer difference.
I would like to congratulate your wonderful presentation. I have a question regarding your second project. I don't know if you know any meta-analysis that previously published.
Yeah, there were 3 meta-analyses published in this topic, but they only investigated the use of AI in skin cancer, so melanoma or non-melanoma skin cancer patients.
I'm asking because regarding the AI programs, I don't know how they evaluated them since they're absolutely different ones. So did they subgroup them based on a mechanism, or they just had one pool of AI programs? Or how did they cope with this difference between these evaluation programs?
Well, these meta-analysis focused on one kind of AI system so that they could compare these systems. But in our meta-analysis, we are planning to investigate all of the AI systems which are available in the market, and we are planning to do a subgroup analysis based on the type of AI that was used in the article.
Oh, so you're not pooling them together?
Well, we'll see how the...
Depending on the data.
Yeah.
Yes. Okay, thank you.
Congrats on the comprehensive presentation. I really like this topic. I have a question regarding your first project. So, when it is useful to use teledermatology, what are the conditions? But I'm more interested in what are the conditions when it is not useful. So which are the limitations and why you can't use in these situations?
So according to the available data, the use of teledermatology is very effective in cases that don't need histopathological examination. So maybe in case of infective diseases or acne or so on, but its use may be limited in the case of skin cancer because these diagnoses are required. So to make these diagnoses, it is required to make a histopathological examination.
Thank you very much.
Thank you.
Congrats to your wonderful presentation. My question would be to your first project. You mentioned the dollars behind the telemedicine and teledermatology. Do you have maybe Hungarian data, how telemedicine could make the patient care more effective and more cost effective? And second thing is, do you know about Hungarian reports who reported about teledermatology that made the patient care more fluent in the past?
Yes, actually there was an app implemented in the dermatology clinic at the first wave of the COVID pandemic, which was an asynchronous teledermatology system, and its use was very effective, I think, especially in the diagnosis of inflammatory diseases. But I don't know anything about the cost analysis.